We are trying to make healthcare not a privilege. It's not. It's something that has to be a little more than a basic right, that you have to be able to get it to how you want it. India is a place where 70+% of healthcare is delivered by the private sector.
It's crazy that you can these days get food and drinks on Blinkit in 10 minutes, but getting to a hospital could be a 45-minute job.
Yeah, Vikram. What can I say? I don't have a solution.
You know, I uploaded my blood reports and my scans into ChatGPT, and it says that this is one additional test that I might need. And the doctor has that sort of expression on his face. Is this becoming increasingly common?
I think that's a good thing. It's better to ask your doctor for questions, and because it's your health, and the more people take charge of their own health, then you'll have prevention.
I've had Americans coming and saying, how long does it take you to get an MRI appointment? I said, you want half an hour, 1 hour? How long do you want it in? And they say it takes 4 months, 5 months, and they pay $6,000 or more.
Look at a company like United Healthcare, Optum. They have 55,000 people in India.
Hey everyone, this is the India Story podcast where we try and figure out how to accelerate the India story. And with us, Shobana Kamineni, Executive Chairperson of Apollo Health. And you know, you've been driving healthcare for a certain while. Health, perhaps one of the most important aspects of the India story. We've got to make sure how we get it to everybody. And I'm going to hope to get from you ideas in the next 45 minutes on how we can do it best.
Got it.
So let's start straight off. Now, of course, Apollo was one of the first big hospital groups in the country, but you're now taking it in multiple different directions, and you in particular are leading a lot of the innovation and the telemedicine and the pharmacies and the supply chain. So talk to us a little bit about that journey.
I think that it's me along with that, we have a nice team. I have to really acknowledge the fact that sisters and the leadership in Apollo, we've always been pushing to say that what's next, driven by, I think that our philosophy is that how many more lives can you touch and be relevant and not just treat them when they're sick, keep them healthy. So I think all this has been part of that journey. And why it's become more important is because everywhere I go, for instance, when we got into e-commerce, very funnily, we had someone join us from our competitors, and they said in the board meetings, they would say, what would happen if Apollo got into this? So I think that in many healthcare businesses or, the future of health, everybody does say, how will Apollo change the game? So if we're not doing things, then it's us to lose. And I think that the way that we have done it before is to be able to do it right and really put the strength of technology, of knowledge, because just imagine the amount of data.
So you're the 800-pound gorilla in the Indian healthcare space, right?
The nimble gorilla. So I don't know if we want to be compared to any animal as such, but if I have to, give me a national...
nimble tiger.
Yeah.
Fine, that's another way to
That's
do it.
what we'd be.
One of the really interesting things when you're looking at the group from the outside is, of course, your father's a complete legend, but also the way the four sisters are working so well and so efficiently together. I can't really think of any such example anywhere else in the world where, the four of you, each with your own domains, driving the business, don't seem there are no at least visible signs of any argument. If there are any, it's carefully, behind closed doors, you may well argue about certain things. Talk to me about that a little bit.
I think dissent is healthy, and also that slight competitive pressure keeps us. It's when you have live sharks in the tank that everybody swims a bit faster. So among ourselves, we do want to push each other to do more, and the greatest thing is that we have a mission, a common mission. How many people can you look after? And that's the opportunity that's India. We're not in 100 other countries or anywhere. We might treat people, but the whole thing is we're Indian. And to us, in terms of a driving force, we're going to be here. These three sisters are my best friends and my co-workers, and we've just grown up in that culture that my mother and father constantly say, make sure that you talk and make sure that, that we all stay together. It's a legacy, but it's not difficult. It takes work, but I think I wouldn't have it any other way.
They're still your best friends, and there's still healthy dissent and healthy arguments
Sure.
once in a while, which is good. Does it help that you have slightly different domains? One of you is looking at operational excellence, Sunita's more into finance. So they're different sort of policies, so they're different roles that each of you seems to have carved out. Is that deliberate, or did that just happen?
It kind of happened over the years, and fortunately it's not extreme. We still have interdependence. If I need to raise money, then I'll definitely go to Sunita. I need some tech advice, sure, have the smartest Sangeeta in the room. And Preetaka has governance, connections. So we kind of work with each other. If they want to talk about scale, they pull me in, or if they want completely different out of the ballpark idea, of course, I'll be sitting in the room. So I think that we kind of work nicely together. The rhythm works.
Before I go to the question that I really want to talk to you about, how do you fix healthcare in India? One more question about the group itself. Apollo Healthcare, which is what you now sort of set it up as a particular entity, presumably with the intention of listing it and taking it out somewhere at some other point, more on the pharmacy, the back end, and telemedicine. Is that correct?
It is, and see, I think, we all saw that we were getting, this discount. Apollo Hospital, by having all these varied businesses, there was a HealthCo discount. So we went and said, how can we set this up? Because the pharmacy it's not a small company. It's like this year it'll be about 13,000 crores. I have a distribution company that is another 15,000 crores that serves 75,000 to 1 lakh daily. Other pharmacies, the supply chain. So we have the best supply chain for pharma, specialized. We have retail, e-commerce. And on top of that, during COVID, we built the digital health platform because we just have so many people that engage. I get 1 million people that come in every day. And we said, now what can we do more for their health journey than just give them medicine? So now on top of that, we can give you the best health insurance, because we know what they want. Also because I was the founder of Apollo Munich, but we just know this business, so the distribution part of that. We have diagnostics, we have telemedicine, and This is at scale. Vikram, 35 million people have downloaded this. And 1 million people walk into our pharmacies every day, another 1 million discover this. So there's scale, and I think putting that as a separate company really is something that is a lifetime opportunity, because what you're creating here is a preventive health and a future health company. And those are so you start valuing it on the basis of, Zomato or whatever these, foundational companies. Of platforms.
Platform plays are always interesting to look at. Right, I'm going to shift from the company a little bit into the problems that you said are the mission for you, which is fixing healthcare. And let's divide it up into domestic, improving healthcare for Indians, and then also perhaps looking at how India can solve global healthcare problems, whether it's by people flying in here or offering telemedicine solutions to the rest of the world. So in India, what do we spend? 3% or so on healthcare? Is that enough? And if not, how can we improve actual healthcare deliverables for most people? Now, if I had to ask you to start sketching out an agenda, which I'm going to try and do in the next 40 minutes, what would that look like?
So it'll be typically that the government has moved from spending 1.5% to slightly more than 2% on healthcare as part of the GDP. But again, health is a state subject. Please remember that they fiercely guard it. Then, of course, we have the Ayushman Bharat scheme, that the Prime Minister started, which is really awesome because it's the largest in the world. But after doing all this, please let me tell you that India is a place where, 70+% of healthcare is delivered by the private sector. After all this. So this is on one side. And so while the government is spending that, people are out of pocket also. If you look at them, and many of them, have started buying some insurance, those that don't fit in it. But then there are a lot of them that we see that, they take loans. Those days that, people fall into poverty almost because they can't pay the bills. It's a small percentage, it's 0.12%, but that gets the headlights. And those are things that you don't want. But more than anything else, I think every day We are trying to make healthcare not a privilege. It's not. It's something that has to be a little more than a basic right, that you have to be able to get it to how you want it. It's just like eating. You can have dal chawal, you can eat in a fancy this thing, but it's up to you.
So there are obviously going to be two aspects of that. One is having access to the healthcare. The facilities have to exist, the hospitals and the clinics, and the rest of it has to exist. And the second part of it, you have to have the ability to pay for it, right? Those are the two things. Looking at the first, obviously you would say that in the big cities, in the Delhis, in the Mumbais or the Chennais, you've got fantastic, high quality hospitals, access to as good as anywhere in the world. And then there's a view that it starts to deteriorate quite rapidly when you go out into rural India and the further away you go. Is that still substantially correct?
It's less now. We have so many hospitals in tier 2, and now with the technology, we can, our doctors can actually go out there. If you have 5 surgeries, they'll go out to the northeast, or they'll go to tier 2 and they'll do the surgeries. So some of that has taken place. There's a flexibility, but by and large, exactly what you said. Our big cities, the top 6 metros are mostly, I think that they have too much healthcare available.
The hospitals are only in X number of places. Is that what you would also expect, that there will be big giant hospitals in a few centers, and then you'll have smaller and smaller centers elsewhere, and then the really critical patients can come in to the major metros?
So the hub and spoke is, on paper looks great, but there are great hospitals, in the tier 2 is also kind of being developed in India. So it's not about the 6 metros anymore. It's about the 112 cities that, you do have medical facilities. It's only for that top 5% of quaternary care cases that you'll have to come to a metro to do it, which is good with this. And then as you go deeper, then you have to find solutions, because you can't physically set up a hospital in the villages that have 15,000, 17,000 people. So then at that point, I think that we go into the realm of technology. With this, and that's the interesting. So you have very cool, sexy technology that we have these robotic doctors who are now, because of 5G, the latency, that we're able to get. So they're trying to experiment. China keeps saying that they've done it, but India also, that, we do remote surgeries. The doctors can, from here, from Chennai or Hyderabad or Delhi or wherever, they can do surgeries in Goa. If we have this thing, and it's the same thing, a robotic surgery, you have a junior surgeon and you look after them, and we can do the ICU remotely. So there's some cool tech happening with the hospital side, and that I think will democratize things. Still be expensive, but it'll democratize as you go on. But as you go deeper in country, then we have WhatsApp, we have apps, we have all these that, if Amazon can deliver you a medicine, Apollo Pharmacy can deliver you a medicine in those places.
When you start thinking about rural India, when you start thinking about the interiors of Jharkhand or deep Orissa or Gadchiroli, some of these places, which is where they really struggle with healthcare, right? Is that where something like telemedicine potentially starts to play a major role? Because if you are unwell, you could technically come. Most people have phones, so they can use the app. But if they're not familiar or they don't know how to do it, maybe you could think of a solution where in every village there is a sort of a little
Kiosk?
Box or a kiosk where you can go to and you can sit down there, and then a doctor sort of is appearing and taking a look at you and maybe doing some basic tests and then deciding whether you need to go to a bigger city.
We alone have 800 doctors that do that for government of Andhra Pradesh, government of Jharkhand, of 3-4 other states. So the state governments know this. Especially during COVID, this was the only way that people would get access with, so that telemedicine was a huge use case. But I want to go one step further. Of a great experiment we did. So the government will provide you these services, and they have this kiosk, but it's still not ubiquitous in the villages, it's the way they use it. So what we did is that if we can get people in a village to come, so we did something with World Economic Forum, a partnership with American Towers, and we did a phygital. So they come in there and do their baseline. once you've established a baseline, so the test, the generic medicine, and a video, this thing through your phone or whatever, and sometimes you can't really, in those places they might not have a smartphone, but just dial. So if you have that as this thing, and we did all that for $15 a year, that cheap. So India can show, we have models out there that can build scale. So I just want to wrap this in a thing saying that we are not that broken in India with this, because whatever the government is doing, whatever the state governments are doing, whatever the private sector is doing, I think that healthcare is actually a service sector which is a sunrise. There's huge opportunity if we train better doctors, if we get those people working on AI and get these things, get some government to open up and allow us to do more of this. I seriously think that we have an opportunity.
So, the opportunity to leapfrog, that's something that India has repeatedly shown, that sometimes you can catch up by using technology and by leapfrogging. We did it with mobile phones, we're doing it with digital payments. I mean, credit cards never reach the last mile, as it were, but Paytm and UPI has reached everywhere. So that digital QR code is in every corner of India, and like a billion plus people are using it long before anybody else could figure it out. So in healthcare, similarly, what people sometimes say, you can use AI to do a certain amount of diagnostic at the last mile, maybe with these kiosks or with phone-driven systems. Is that something that you think we can rationally aim for and shoot for?
We can, and we are, but I just want to say that there's this whole thing, there's a big disclaimer around it, because if you go on to ChatGPT, anyone who has a paid version or a free Perplexity, all that, and you put your health in there, and it'll give stuff, and you'll be so impressed. Oh my God, this is better than my doctor when you go and check and do this. But actually, what they don't realize is that it doesn't know who you are. And this is what a system like Apollo, that we have the medical records of almost 100 million people. And when those people access this, we actually know Vikram Chandra, 30 years old.
I wish.
And just, maybe, your health record sitting with us. So the quality of discovery and the quality of the answers you get are actually better. And then it steps forward to say, do you need to, if this is there, it doesn't scare you. It says, let's get you an appointment with the doctor. Here are your choices. So it actually engages to finish that loop that ChatGPT and all don't do now. To me, that is the exciting future.
So I think you're absolutely correct. And if you don't mind, I wouldn't mind brainstorming this with you for a couple of minutes, because I think it sounds like a really exciting idea going ahead. You have the records, right? And there are other hospitals and other chains which would also have records. If you come back to that idea of a kiosk or a box somewhere in a little village with 10,000 people, so therefore they don't have access, maybe once they will go to the city, they've been unwell, they've had some problem with their breathing or something's gone wrong with them, they've actually made the trek into the city and they've registered in a clinic or they've registered with a hospital or with a doctor. That information then exists. So now when they're going back and saying, I'm not feeling well, the AI is recognizing them. The person's maybe entering their Aadhaar number or something. So the AI is recognizing them, is able to access the medical records to some extent, and is therefore then able to say, well, I think you had this episode 4 years ago, so maybe you're having a heart attack, and therefore you need to go to a doctor really fast. And to another person and saying, no, your blood tests were all fine, everything's absolutely okay, nothing needs to be done.
And what you've articulated is probably the vision of our ministry, that, using the CoWIN, building the India health stack. And no other country has done it before. I have a hope that India will do it.
There'll be privacy concerns, and I mean, people will say that everything which I've said is dystopian, and you've gone crazy, and you can't do this because what about health? Yeah.
Which is why for the 120 million or the 200 million people who care about privacy, I think that that's what we're building for. And it seamlessly will come in. It gives you the privacy. Here's the important point. I don't believe that anything that you offer free is valued with that. So there has to be a price, because now for instance, people don't understand, but when you go to ChatGPT also, there's a cost for us for getting serious answers, which is why you have the paid version. It's the same thing for us, that when people ask deeper questions, so we use multiple LLMs, we use open source, we use our own data, and these are all happening seamlessly, okay? So nobody knows because it's happening in nanoseconds. But there's a cost to it. Every query might be 4 rupees, 5 rupees, or if you want a voice in it, and how that comes down. It won't be expensive, but we've found, and this is the exciting thing, that I actually have a crore of people that have seen a value to pay for it. And I think that to me is the future of medicine.
One more thing which could take this forward is your ability to do remote testing. So in these same kiosks, as we are
Sure.
calling them, if you could have a system where somebody can sit down in a chair of some sort which has the ability to draw blood, or maybe you could train probably somebody to draw blood, but can take blood pressure, can take the pulse, can take a few basic tests, will probably give your remote doctor, or an AI for that matter, a considerable amount of information about you.
A retinal scan will tell you so much of the face scan. This, we're in the age of Star Trek with regard to the way medicine and technology is leapfrogging. So I can very well see that the most powerful thing you have is the camera on your cell phone. And more people, we're a nation of how many? 900 million cell phones?
More than a billion.
More than a billion cell phones. So many of them have. So this inertia of moving to a kiosk, we've done it. Government has done it, and they have the ASHA workers behind it. But really the leapfrog is when you can bring it to them. I can take it today. I mean, like if you're on a trip, suddenly you don't feel well, see your doctor 24/7. He'll scan you. You press this thing on the camera. They'll check your BP and say, okay, maybe you need this. So there are things happening. There's some technology that is already ready, and I think what we call Ask Apollo. So when you go in there and it knows and it talks to you, for instance, that we have the same version for doctors. It's so amazing because, tell me, if most people have gone, when you go to 3 doctors, each one will say something different. Now what we've done is that we've actually said 80% is all AI. It gives you the differential diagnostics because it has LLM, it has more than 100,000 journals, it has medical records and specialists. So it gives them saying, this could be your differential diagnosis, this is the medication. And 20% is interpretation, because you can never replace a doctor. Please don't even ask me the question.
So you already reached that situation where somebody walking into a doctor is getting that AI assistance.
Apollo.
Because no doctor, as you rightly said, is going to read 300 journals on a daily basis, look at every paper that is out there. So that assistance that, hey, hang on, this could be X, which you may not have thought of. That insight is available with every doctor?
Today. It's
And are they
there
using
in Apollo. They are. More and more have started using it. You'd be surprised. Even the older doctors now have seen that it's useful, and it makes them so much more productive with this because they have everything there, So, and the nice thing is the patient doesn't have to come in for the second. You don't have to go physically. Very often they'll tell their patient, they'll say, why, you've already come, no? We're on to this thing. I'll just do this just get on the 247 app and we'll do this live. And this is really made it efficient.
I've probably annoyed more than a few doctors by, when I'm walking into them, I've said, I uploaded my blood reports and my scans into ChatGPT, and it says that this is one additional test that I might need. And the doctor has that sort of expression on his face. Is this becoming increasingly common?
It's been there ever since Google. ChatGPT is new. Otherwise, Google doctor is the most famous doctor in India. And
मैंने Google किया था और Google कह रहा है कि.
Yeah, but I think that's a good thing. It's better to ask your doctor for questions. And because it's your health, and the more people take charge of their own health, then you'll have prevention. Then they'll go for checkups, they'll take the right medication. All these things will happen. I'm a big believer in doing this.
So, there'll always be people who'll say, well, this is all very well, but telemedicine and, remote doctors and AI is never going to be as good as going in and seeing a doctor. But But sometimes I think they don't factor in. It's very easy to say that if you're sitting in Delhi or Mumbai and you have access to the best of doctors and you can go into them. If you're in a place where the alternative is either you may have got something serious and you're having to get into a bus and travel for a few hours, or you got to take advantage of whatever the expertise in the village is, it's better than that, probably.
You're absolutely right. But it's also right that if you've seen your doctor 3 or 4 times physically, you don't need to go that often, especially if you're stuck in Gurgaon in the rains.
Oh, anywhere else. Yeah, I mean, we're talking about remote places. I did include Gurgaon in the rains as one of the potential remote places.
I'm just being facetious about it.
Bangalore, for that
but
matter,
traffic,
can be
traffic,
access to
parking, all that. And when you're old, it's this thing. It's so much easier. You know what? A great use cases that we've seen is women. That very often when they come in for diagnosis, it's a bit late because they're always waiting for someone to bring them, my husband, time, my child. And now when you can take this in your own hands and start doing stuff, I think early diagnosis will be very helpful for India.
You know, now, I just want to digress a little bit on this question which I was just talking about when it comes to traffic. Must be something that causes you and everyone else associated with healthcare a lot of stress. There could be people having a heart attack or a stroke, and they may even call for an ambulance. It'll take the ambulance 20 minutes to get to them and half an hour to get to the hospital, or maybe more, because nobody moves aside, and even if they wanted to move aside, they can't because the roads are blocked. So it's crazy that you can these days get food and drinks on Blinkit in 10 minutes, but getting to a hospital could be a 45-minute job. A lot of people must be dying because of this.
I think that not enough is said about it. This is one thing that India does not do well. No matter that we have 108, we have all these ambulances, we have 106. But you're right, you just can't do anything about that. And it's not that easy like a two-wheeler that you can try. We actually tried to get a doctor on a motorcycle rider to be able to get that through the traffic. Yeah, Vikram, what can I say? I don't have a solution.
Would one of the possible solutions be to have a lot more ambulances which are equipped with more and more life-saving equipment inside it? So, and if you station them in virtually every neighborhood, then they can get to people much faster. And once that happens and they're in the ambulance, and if it's a stroke or it's a heart attack, then at least they're starting to get treatment immediately. It would mean, I don't know what the losses will be and what the financial part of that would be, but perhaps that's the solution.
It's a great idea because one is that our ambulances always go with the doctor. They'll take care of a stroke, heart attack. So those are moving little hospitals. So when it goes out. And like you said, if we can solve it almost like a dark store problem.
Exactly.
But you have to have that density and you have to plan for it. I really hope somebody listening to this podcast will pick this up, Red Health or any of these.
I'm about to suggest you listen to it because nobody better than you to do it, or you can discuss that over dinner this evening. And maybe if at least, and it's a great start, right? If you actually have a bunch of ambulances and there's a number there, and it is like a dark store. As I said, if you can solve it for so many different goods in a dark store for Blinkit or by Zepto or by whoever else, Swiggy, I can't see why we can't have X number of ambulances in the cities which just get to you. Think of the lives you'll save and the number of people who will bless this podcast when they're not stuck in traffic.
Let me do some study on it, and in spite of the podcast, I will directly call you back in a couple of weeks.
If we get something going out here, then I will have considered this year well spent. Okay, let's
idea.
All right, thank you so much for that. Now let's come to the other to the second part of what I was saying. One is having the facilities, and the other is being able to pay for it. Now, if anybody comes from abroad, they say, "What are you guys cribbing about? The price of healthcare in India is ridiculously cheap." I mean, especially if they're coming from America. When they come from America, they cannot believe it, right? As to what.
And the fact that you can get your report in the same
day. And you can get an appointment in the same day.
An appointment, your report. They are a broken healthcare system.
I've had Americans coming and saying, "How long does it take you to get an MRI appointment?" I said, "You want half an hour, 1 hour? How long do you want it in?" And they say it takes 4 months, 5 months, and they pay $6,000 or more for it, right?
And to see a specialist.
Oh, don't ask about it.
Yeah,
Don't
takes
ask about it.
months.
I once went to a dentist in Boston, and that dentist gave me an appointment after 4 people called him and they pulled in favors and they requested him, and I went and finally got an appointment. He looked at me and said, "You should be grateful I've agreed to see you." And the bill was $750 for
Oh
filling a
my
cavity.
God.
You can get a root canal done in India for $100 or $200
By a really fine doctor.
by the best doctor in
Yeah.
India at that. So yeah. So okay, but that's the US, right? So the price of healthcare, can it be brought down lower, or is it tough to do? I mean, is it really insurance that we have to now start thinking about?
It's two things. It's you get what you pay for. If you want a specialist who's put in so many years of work behind it and all that, I do think they deserve that. It's going to cost more. If you're going to have the technology, a robotic technology that will get you out of the hospital in 1.5 days, it will cost you more than having this old-fashioned cut and 21 days that you're just knocked out with that pain and those painkillers, all those. So I think that one is that people have to understand what they're paying for, that is not transparent. So the problem in India is transparency. It's not, once they understand what it is, people really appreciate what they're getting with this, because at the end of the day, there's no price on health when you want this. But then how do you make it no longer a privilege but almost a right, is that we must have more financing mechanisms, and that's where health insurance comes to play.
How big has Ayushman Bharat been? I mean, are a lot of people being able to afford really good healthcare because of it? Have a lot of people taken it up? Or is there still the requirement and the need for a lot more private health insurance?
And there's a certain population. The gap is the middle class and upwards in India, which is fairly large. They're almost about, the opportunity is about 500 million people that should be insured by private insurance, and which is why we have the fastest growing health insurance in the world. But again, they struggle because there's no transparency with the hospitals, how we do it, their pricing and how we look at it. So those are all being corrected as we move along, because we're still young. This industry is not more than about 10 years old. And so as it keeps improving, you'll find more and more people coming into the insurance. But you know what really bugs me, and I say it all the time with this, every single person has a motor insurance, but you don't have health insurance. I mean, why? Why can this not become mandatory in the country, at least to a certain extent? Then after that, you pay for this thing. You have PF, you have all these. So you have two sets of people. I think the people that are in jobs and companies, more of those are covered. But India is about those single traders, small companies, MSMEs. We have to find a way to pull more people into that group of this, to get these 500 million people insured. Once you do that, then the premiums will come down, the cost, and the insurance companies are the ones that will drive pricing and efficiency to the right level if they do it.
Let's turn to India's interaction with the world when it comes to healthcare. India is sometimes called the pharmacy of the world because we supply so much of it. Have you ever thought of literally setting up a platform that could be the pharmacy of the world, where you can, log on and buy, drugs from India at a substantially lower price than what they're getting there, and ship it across?
It's so not allowed with this, because every country you need to do your licensing.
Yeah.
Drugs are heavily licensed. This is a
No, I'm talking about
huge
FDA
license.
approved and licensed drugs. It still can't be done.
Yeah, because you have to go to that country, you have to file every country, even a small African country or any of these, they have their own filing. It's very difficult. You can do a one-off shipping to somebody who's there, who wants to send it to their parent or to somebody, but that will not
But
happen.
otherwise, this has to be B2B business, is what you're saying. In a sense, you're supplying generics. Indian pharmaceutical companies are supplying generics
in
to
America,
the users
they do it,
and vaccines. How do you see that business continuing? I mean, you're plugged into the healthcare space. There's some concern, of course, whether tariffs will ever come on that. But by and large, do you think Indian pharma companies are doing well?
I think the last couple of years, Indian pharma companies have been pushed to do better, because you have these small Chinese outfits. We really don't invest enough in research. And look what happened to all the APIs. You know, the bulk that you need to make these medicines are all out of China. They invested in capacity, got it cheap, did this. Then they leapfrogged into research. 10-man science companies that are in licensing to the US. Now India's got into that act that we have biosimilars, we have all these. So I think that Indian drug manufacturers are all, I respect them with that. They sell to me and I get, you know, our pricing is the best in the world. So I respect that. But they're also able to make sure that not only are they competing and giving the best prices, but they're now moving into novel drugs, they're now moving into biosimilars, cancer medication. These are good things for India.
So IT services are what built the India story back in the 1990s and the 2000s. Do you see healthcare and biotech and pharmaceuticals driving the India story in the next 10 years or 15 years?
I think GCCs are the ones driving it.
Yeah, right
so
now.
across industries. If you look at now, what we're doing is that we're helping American healthcare companies, but we don't really need, I mean, look at a company like United Healthcare, Optum. They have 55,000 people in India. 55,000 people in India. It runs their system.
Please don't tell Mr. Trump that. He'll get really upset. But anyway.
Hey, that's up to you. If he's listening to your podcast.
It's not geo-blocked, unfortunately, but I don't think he's watching the podcast.
No, but today's paper I actually saw that's they want to bring a tax on you know, offshoring of these. But to me, that's it, because I met
because
so
some of these
many
companies
CEOs.
have 30% of their workforce in India. What are you going to do?
Absolutely. Financial services.
It's not just health. It's like
Deloitte,
Deloitte, Accenture,
everyone,
Amazon, Nvidia is 15% of its workforce in India. How are you going to stop all that?
Thousands of engineers. And I think, to me, that is the magic of India because we're going to have 1 billion people in the workforce very soon.
Yeah.
I would love for healthcare to be the biggest player. But again, what you said, there's an opportunity of India being the healthcare delivery, not just digitally of the back end, but physically. There's so, you know, because at the end of the day, this is a touch industry. We have to go there and make sure. So for an aging world, healthcare diplomacy in our neighboring countries, how many of them used to come, Vikram, to us?
Yeah.
From Bangladesh, from all these countries. We were really the backbone.
So this concept of medical tourism, which was a big buzzword that the entire world is going to fly to India, go and see the Taj Mahal and then get an operation done. I mean, who knows, may still happen. How much do you think that's a real possibility, medical tourism in India?
I think it's still an opportunity, and we get patients from 120 countries. What is funny is, none of those healthcare systems have been repaired with that. If you look at Africa, it's not like they've leapfrogged or they have enough this thing. They still have to come for tertiary care. Our neighborhood still have to come to India or go wherever, to Singapore or Thailand or wherever you can afford it. But you know, this is the thing. The opportunity exists because those systems have not caught up. How much we are doing, as much as ease of doing business, I think that we need a special relationship, because you can't get visas. If you want to get for Thailand, visa, it takes you hours. They want to question if you're coming. So the first step of visas, or you know, the touts that come in there when they'll want to take you to some shady place or whatever. So all these, when we can come and clean it up and make it neat, you know, that's when this is a big story, because India is fantastic healthcare.
So the other time when this could get accelerated is, I think around the world there is a lot more talk about preventative healthcare, as opposed to, you know, wait till you fall sick and have a heart attack and then you figure it out. So the minute that starts to happen, then there will be people who will say, oh, what about yoga and Ayurveda and, you know, meditation and maybe some of these things. That's when the India brand name starts to, you know, catch on a little bit perhaps.
These are things that can go to those countries.
Yeah.
There's enough yoga all over the world.
That's true also. You don't have to fly to India for that.
Yeah, you don't have to fly
But that
to
association then starts to get built up maybe.
So what's interesting is the Ayurveda, really. But we have to make it, again, we bought the largest chain of Ayurvedic hospitals, Ayurveda, because what we're trying to do is to create actual scientific connections in that. So when people come, they get it, right?
Yeah.
So it's not just somebody comes in there and you have this treatment, but there's some science behind it. I believe it's a big opportunity, and it's not like we don't have fantastic centers in India.
Yeah.
People come from all over, but it's so high end. If you really want the best care, it's expensive. It's 1 lakh a day and stuff like that. So people can go, they have choices to go to other places.
Okay, before I allow you to go, one more question. You were the first female president of CII, which was great. The question of woman leadership in India. Tell me, what are the main issues and challenges, if any, that there are around that? And what did you feel in your stint as the first woman president of CII?
I didn't want to stay away from the subject because, but I engaged to some extent and created a platform and everything. But Vikram, to tell you the truth, this is one area that, no matter how much we speak that Indian women, 50% of the economy, if they come in and how we'll rise. But the reality of it is lots more needs to be done in terms of leadership. First of all, India's MSMEs are in such bad shape, and that's where lots of these sit for startups, MSMEs, and generally everyone is struggling. So women leaders in the last couple of years has been this. In terms of corporate leadership, I think that we need to do more. The women that I know in India, super awesome. I just wish that we had multiplied it by times 10. We cannot set a path to saying that we will have a 10 trillion, 20 trillion, 30 trillion economy unless there's more participation by women across the chain. And in terms of this, the leadership level and the entrepreneurship level, low. But in terms of the science and the STEM and the medical, 50% of most of the doctors today are women. So they're coming in to study. So I think generationally the change is happening in homes, especially in urban homes in this thing. And that to me is hope for the future.
I think that's absolutely correct. All right, if you were to look in the next 5 years or 10 years, what would be your ideal vision for Indian healthcare and any major changes that you would like to see?
We need to create transparency, accountability, so that the insurance will rationalize that, and so hospitals, will get a fair shot, because it's the easiest thing to do is to pull hospitals down. They don't realize this negative talk of one thing, one bad apple. So I want, if there's more transparency in the system, so in 5 years, if I really have to see it, if there's more accountability and transparency, I think people will understand the worth of what they have in India. And then on the other side, what we are doing as a platform, I seriously think that India could be the UPI, same story of health, that we make it so ubiquitous and useful for people valuing their privacy, that will overcome this huge problem we have with NCDs. So if we can really say that, the number of stage 4, stage 3 cancers will reduce because we're testing and catching them earlier, that people dying from blood pressure, diabetes now becomes a controllable. And all this can be done only when you have a serious, good preventive and affordable and understandable digital.
I think those are great ideas, but I'm going to end as always.
But
do.
we'll still do your ambulance idea.
Ambulance idea you've got to do. I'm going to keep calling you every day till that ambulance idea is done.
Okay.
But I'm going to end with my rapid fire round, where just 1-2 word answers to some of these. What's your leadership mantra?
Get it done.
Get it done. What advice would you give young women aspiring to lead in healthcare?
Stand out.
Okay. A healthcare innovation at Apollo that you're the most proud of?
Our AI capabilities, or the clinical intelligence engine and Ask Apollo.
The biggest challenge you think facing Indian hospitals today? Ambulances.
Transparency.
You were saying transparency. I quickly threw in my ambulance idea.
You take your ambulance idea.
Ambulances. Okay, fine. We're going to agree on ambulances. I've convinced you to change that. All right. Lifestyle habits among Gen Z that concern you?
Too much social media, screen time with this.
Oh.
So they're...
Worse, that's you think is a bigger problem than sugar or alcohol? Or
all that becomes when you're sedentary and looking at this all the time, and it messes with your mind, the kind of mental problems we're getting from these people.
Okay.
If they can put this aside and just do 2 hours of it, and when they need it, just think how much of their day becomes open to get back out there.
All right, a lot of people so concerned about heart disease and strokes. Do you think technology is going to help with that?
If they use it, people that don't use it will still have that because we're predisposed to it.
Shobana
Knowledge.
Kamineni, thank you so much for
Thank
joining
you.
us. Thank you.
Thank you, Vikram.